Honourable Speaker, the government committed in their previous two budgets that increased spending in healthcare would mean increased access. However, since August, 3 hospitals have been grey-listed by the Manitoba Nurses Union, citing physical and sexual abuse, regular harassment, and several other safety risks. Can the minister help us understand why, if this government is supposedly prioritizing healthcare, are nurses still feeling less safe at work while wait times continue to rise and conditions continue to deteriorate?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, I welcome that question from the member from Tyndall Park. I think it's a really important one. Our government has improved access to primary care. We made very clear that more Manitobans need access to health services, and we're doing exactly that. Those aren't my words. Those are the words of the president of Doctors Manitoba, Dr. Desilette. But we know that there's much more work to do. The previous government spent 7.5 years trying to destroy our public health care system. They were stopping at nothing to cut, create chaos, and disrespect healthcare workers. We know that we're feeling the impacts of that today. We know we're going to feel the impacts of that for years to come, but we're going to continue to keep our foot on the gas, recruit and train record numbers of healthcare workers, and make sure that Manitoba can continue to lead the way in access to primary care.
The Honourable Member for Tyndall Park on a supplementary question.
Honourable Speaker, every day we see in the media how healthcare professionals continue to report being overworked and strained, and how patients are having to wait devastatingly long hours to be seen in emergency rooms. It is tragic that in 2026 alone, at least 4 Manitobans have died and more than 24 have suffered serious harm while waiting for care. Honourable Speaker, we understand that change can take time. But what is the government doing to prevent any more tragedies or grey-listed hospitals in the meantime?
The Honourable Minister of Health, Seniors and Long-Term Care.
Again, I thank the member for that really important question and the authenticity of which she poses that question in the House today. You know, our government takes very seriously addressing the healthcare concerns that were created by 7.5 years of an irresponsible and callous PC government. There are members on that side of the House that were around the cabinet table of the PC caucus when they were cutting healthcare, when they were firing nurses. In fact, their current healthcare critic was an advisor to Heather Stephenson when she was firing nurses from across Manitoba. Wow. On this side of the House, we're focused on not only repairing that damage, but strengthening healthcare for the long term. Nurses deserve to be safe at work. Healthcare workers deserve to be safe on the job. We've been able to hire net new healthcare workers in spite of the grey listing. We're going to keep our foot on the gas and hire thousands more to make sure our sites are safe.
Time has expired. The Honourable Member for Tyndall Park on a final supplementary question.
Honourable Speaker, for the last 2.5 years, Manitobans have been promised that access to health care would not only be restored, but it would be improved. Yet this year alone, 4 Manitobans have lost their lives while waiting for critical care, all while nurses, represented by the Manitoba Nurses Union, continue to raise serious concerns about workplace safety. Given these ongoing concerns from both patients and healthcare professionals, can the minister give Manitobans a timeline for when these issues will be corrected in our healthcare system?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, I can reassure Manitobans that healthcare is going to remain our top priority. We know it's the top priority of Manitobans. We're going to continue to invest in training and recruiting record numbers of healthcare workers, adding hundreds of beds back to the healthcare system that were cut by the previous PC government, and listening to healthcare workers, the very people we've been working side by side with to strengthen healthcare and address the damage that was done. But, Honourable Speaker, I do think it's important to note that the Leader of the Opposition himself has gone out publicly to say that it will take years to fix the damage that he did to healthcare. In fact, Honourable Speaker, the Leader of the Opposition himself said it can't be done in just one term of government. So what I would say to Manitobans is this: never, ever, ever should we ever see a PC government ever in Manitoba again. Keep working with us to make healthcare better for you.